Welcome to this 15-minute clip about diarrhea in children. In this video, we'll discuss what diarrhea is, why it's important for parents to be aware of it, and its impact on children's health. Diarrhea is a condition that involves the frequent passage of loose or watery stools. It's a common health problem among children, especially those under the age of 5. Diarrhea can lead to dehydration, malnutrition, and even death if left untreated. As a parent, it's important to know the signs and symptoms of diarrhea so that you can take appropriate measures to prevent and treat it. Diarrhea is defined as the passage of loose or watery stools more than 3 times a day. It can be caused by a variety of factors, including infections, food allergies, and certain medications. Diarrhea can also be categorized as acute or chronic, with acute diarrhea lasting for a few days and chronic diarrhea lasting for several weeks or more. The causes of acute and chronic diarrhea may differ, so it's important to seek medical attention if your child experiences diarrhea for an extended period of time. The most common causes of diarrhea in children include viral and bacterial infections, food allergies, and lactose intolerance. Viral infections such as rotavirus and norovirus are the most frequent cause of diarrhea in young children. Bacterial infections can also cause diarrhea, including Salmonella, Shigella, and Escherichia coli, E. coli. Additionally, food allergies, especially to dairy products and gluten, and lactose intolerance can lead to diarrhea in some children. Poor hygiene, contaminated water, and unsanitary living conditions can contribute to the spread of diarrhea in children. Fecal-oral transmission is a common route of infection, where fecal matter containing harmful bacteria or viruses contaminates food, water, or surfaces. Therefore, it's crucial to teach children the importance of good hygiene, such as washing their hands with soap and water after using the bathroom and before eating. It's also essential to ensure that your child has access to clean water and lives in a clean environment. Diarrhea can be classified into different types, including watery diarrhea, bloody diarrhea, and persistent diarrhea. Watery diarrhea is characterized by loose or watery stools and is the most common type of diarrhea in children. It is often caused by viral or bacterial infections and can lead to dehydration if left untreated. Bloody diarrhea, also known as dysentery, is characterized by the presence of blood in the stool. It can be caused by bacterial infections, such as Shigella or E. coli, and requires prompt medical attention. Persistent diarrhea, which lasts for more than 2 weeks, can be caused by a variety of factors, including parasitic infections, inflammatory bowel disease, and food intolerances. It may require more extensive medical evaluation and treatment. It's important to identify the type of diarrhea your child has to determine the appropriate treatment. For example, watery diarrhea may be treated with oral rehydration therapy, while bacterial infections may require antibiotics. In cases of persistent diarrhea, additional testing and treatment may be necessary. If you notice any blood in your child's stool or if their diarrhea persists for more than a few days, seek medical attention. Dehydration is a serious complication of diarrhea, particularly in young children. It occurs when the body loses more fluids than it takes in, and can lead to serious health consequences if left untreated. It's important to monitor for the signs of dehydration in children with diarrhea, which can include dry mouth and throat, decreased urine output and dark urine, sunken eyes and a dry, cool skin, lethargy or irritability, rapid heartbeat and breathing. If you notice any of these symptoms, seek medical attention immediately, as dehydration can lead to shock, seizures, and even death in severe cases. In mild to moderate cases, oral rehydration therapy, which involves drinking fluids containing salt and sugar, can help restore the body's fluid balance. It's important to encourage your child to drink plenty of fluids, such as water, broth, or oral rehydration solutions, to prevent dehydration. The treatment of diarrhea in children depends on the severity of the symptoms and the underlying cause. The following are some of the treatment options. Oral rehydration therapy, ORT. This involves drinking fluids that contain a balanced mixture of salts, sugar, and water to prevent dehydration. Oral rehydration solutions are available over the counter, or you can prepare them at home using a recipe recommended by your doctor or a reputable health organization. Probiotics. Probiotics are good bacteria that can help restore the balance of the gut microbiome and alleviate diarrhea. They are available in supplement form or can be found in foods such as yogurt and kefir. Medications. In some cases, medications such as antibiotics, antiparasitics, or antidiarrheal agents may be prescribed by a doctor to treat the underlying cause of diarrhea. In addition to these treatments, home remedies such as the brat diet, bananas, rice, applesauce, and toast, can help alleviate symptoms of diarrhea in children. The brat diet is a bland, low-fiber diet that can help ease stomach discomfort and reduce the frequency of bowel movements. Other home remedies may include increasing fluid intake, avoiding dairy and fatty foods, and getting plenty of rest. It's important to note that not all home remedies are effective or safe, so it's best to consult with a healthcare professional before trying any home treatment for diarrhea in children. If your child's diarrhea persists for more than a few days, or if they show signs of dehydration, seek medical attention. Preventing diarrhea in children is important for their health and well-being. The following are some steps that parents and caregivers can take to prevent diarrhea in children. Good hygiene practices. Encourage children to wash their hands frequently, especially before and after eating and after using the bathroom. Teach them to use soap and warm water, and to scrub their hands for at least 20 seconds. Use hand sanitizers when hand washing is not possible. Access to clean water. Make sure that children have access to clean and safe drinking water. Boiling, filtering, or adding water purification tablets can help make water safe to drink in areas with poor water quality. Proper food preparation and storage. Ensure that all food is properly cooked and stored, especially meat, poultry, and eggs. Avoid consuming raw or undercooked foods, and wash fruits and vegetables thoroughly before eating them. Breastfeeding. Breastfeeding provides essential nutrients and antibodies to help protect infants against diarrhea and other infections. Exclusive breastfeeding for the first 6 months of life is recommended by health experts. Vaccination. Some vaccines can protect against common causes of diarrhea in children, such as rotavirus. Consult with a healthcare provider to learn more about recommended vaccinations for your child. By taking these preventive measures, parents and caregivers can reduce the risk of their children developing diarrhea and other infections. It's important to maintain good hygiene practices and healthy habits to promote the health and well-being of children. In conclusion, diarrhea is a common and potentially serious health issue in children. Understanding the causes, symptoms, and treatment options for diarrhea is important for parents and caregivers in order to prevent dehydration and other complications. Good hygiene practices, proper food preparation, and access to clean water can also help prevent diarrhea in children. By following these guidelines and seeking medical attention when necessary, we can help ensure the health and well-being of children.